My name is Dr. Tom Ford. I'm an interventional cardiologist and PhD candidate that's funded through the British Heart Foundation to work here at the Golden Jubilee Hospital. So I want you to imagine that you are suffering from chest pain, and that's the situation that many tens of thousands of people in the UK find themselves in every year. The test to diagnose blockages in the arteries, which is a common cause of chest pain, involves an invasive procedure. Now, this invasive procedure doesn't reveal any blockage in up to half of patients. So really, that's a lot of patients that are leaving our facilities without a diagnosis. And with diagnostic uncertainty, that leads to therapeutic uncertainty. We don't know how to manage these patients. Professor Berry and I are very interested in developing a better solution for patients in this common problem. The British Heart Foundation CorMicA study is a collaborative effort from the University of Glasgow, the Golden Jubilee Research Foundation, as well as patients and research staff in both centres. So we're focusing our efforts to diagnose problems that could be missed on an invasive angiogram. And I think this is really important because our patients are seeking our advice to get a diagnosis. And without the diagnosis, we can't offer them a proper treatment. So in a nutshell, what we've performed is the first randomized controlled trial in this patient group, whereby we're allocating patients either to this new procedure which allows a diagnosis of disorders of the coronary artery that would be missed potentially in standard care. Half of our patients were randomized to receive standard care. And what we showed was that patient-centered outcomes, so that's symptoms like angina severity and quality of life at 6 months, were significantly greater in the group that was randomized to a novel diagnostic procedure. And looking at where this may go, ours is a relatively small study and it's really proven, it's a proof of concept. The next step really is looking at potentially a larger multi-centre study to see if this concept can be borne out in a larger number of patients. Okay, so I think sometimes a graphic example would be more helpful. So I've got an angiogram here, which is the test to look at someone's arteries. And this involves an invasive procedure where we pop a tube from the wrist and it goes into the heart arteries and it allows us to take x-rays. And so we're looking at x-ray pictures of coronary arteries and they look visually to be nearly normal. So there doesn't look to be anything that could cause this patient's symptoms. Now in standard care, that's the end of the test. In our study, we feel that these patients do need additional tests to prove that there is a disorder or that there isn't a disorder. We would prefer to answer the question. So what we can see here is after giving a medicine down the artery is essentially closed off. And that picture represents intense spasm of the very small arteries that we cannot see. And it's only by doing these extra tests that we can diagnose this disorder, which is a form of microvascular spasm. This picture is reversed within 2 seconds and the artery goes back to normal. So the patient had chest pain when the artery was blocked and it's now been reversed, and that allows us to give the patient a diagnosis and change their therapy. I just want to take this opportunity to extend our sincere thanks to the patients who participated in the study. And it's without these patients from throughout Scotland, without their support, we wouldn't have been able to have done this study. Many of them underwent tests without any benefit to themselves, and we extend our sincere gratitude.